Good afternoon. I'm Dr. Stephen Graham with North Shore Urological Associates here at North Oaks Hospital in Hammond. And I wanted to use this opportunity on Facebook Live to discuss some men's health issues. June is Men's Health Month, and so there's certainly a variety of issues which we can discuss. And since we're doing this live, I'd love to answer any questions that you might have. You can submit your questions anonymously on www.northoaks.org/Facebook Live, or if you join us for the event, you can submit your questions in the live feed. And we'll be going over topics such as recommended health screenings and other various treatments for urological issues. I'd like to also say that the information I'll present will be general and educational in nature and not intended for specific medical advice. For that, you should consult with your personal health care provider or make an appointment to come see us.
So can you tell us a little bit about what a urologist is and what you do?
Sure. So a urologist is a physician that takes care of the urinary system, which starts with the kidneys, down the ureters into the bladder, and then out the lower urinary tract. So we take care of such issues as urinary tract infections, kidney stones, and then more complex issues like kidney cancers, bladder cancers. And we also include, specifically in men's health, things like low testosterone, erectile dysfunction, urinary incontinence, and enlarged prostate, as well as prostate cancer.
What are some common conditions that a urologist treats for men?
So not only do we treat men, but we also treat women and children too. But specifically for men, we'll commonly look at things including difficulty urinating, that commonly has to do with the enlarged prostate. We'll see them for prostate cancer screening, prostate cancer treatment. We'll also evaluate them for symptoms of low testosterone, discuss possible evaluations for that, as well as treatment options for that, as well as medical conditions that affect both sexes, including kidney stones and urinary tract infections.
For kidney stones, what are treatment options?
In general, we'd love for you to try to pass a kidney stone on your own, with the help, of course, of some pain medication. But there are other treatment options available when the situation arises. Commonly, that includes shockwave lithotripsy, which is a non-invasive way to help break up a stone using sound waves. Another option is ureteroscopy, and that's where we take a patient and place him under general anesthesia and use a scope to enter the urinary tract and go to the location of the stone, where we can do various treatments including laser lithotripsy, breaking a stone up with a laser. And if the stone is severe enough and large enough, there's even cases where we'll have to go in through the back directly into the kidney to help treat stones in that location.
Is this procedure performed in office, in the operating room?
Most of the time with kidney stones, if anyone out there has ever had a kidney stone, you're usually crippled on the floor in pain. You've already gone to the emergency room. So in dealing with this issue, most of the time you're going to be in the operating room asleep under general anesthesia.
So what procedures do you perform in office?
As urologists, we are lucky in the sense that we get to treat patients both with medications, but also with office procedures, and should the need arise, operating room procedures under general anesthesia. In the office, we can do things like vasectomies. We can do cystoscopies, which is a procedure where we'll insert a scope in through the urethra to evaluate the bladder, commonly to evaluate for blood in the urine. We'll also be able to remove things that are not in a great location, and shouldn't be there. And we can also do more evaluation on the bladder, specifically for patients that have complex urinary issues.
What new technologies are you using?
So in urology, we try to be at the forefront of technology, and there's often meetings to go throughout the year to try and stay up to date. In the operating room, there are procedures done using robotic surgery, which is a form of laparoscopic surgery or minimally invasive surgery. It's not that a robot is doing the surgery. The surgeon, the urologic surgeon, is still in control, but that's done for a lot of surgeries done in the abdomen, on the kidney, and on the bladder. There's also procedures that are done in the office or in the operating room, more commonly in the operating room, to treat enlarged prostate. In our practice, the urolift procedure is a more minimally invasive way to treat enlarged prostate in men suffering from symptoms from that without some of the more potent side effects that can be included with some of the traditional surgeries.
We have a question from Ron on Facebook. My father is 80. What can he do to continue good urological health?
Thanks for sending in a question, Ron. That's a good question, and we do treat men of all ages because you're going to continue to have problems as you get older, and it's oftentimes that men, as they get older, will find more problems, specifically with urinary health. Traditionally, if he's following with a primary care physician and he has a specific issue that he feels is related to the urinary tract, whether it's waking up too often at night, frequency during the day that's bothersome, urinary tract infections, the primary care physician will oftentimes do a screening urine test called a urinalysis, and if there are problems on that test or there are just issues that cannot be managed by the primary care physician, they get referred to the urologist. But to put it simply, emptying out the bladder as often as possible, maybe every 2 to 3 hours during the day, regardless of the sensation to urinate or not. Making sure that water is what you drink the most every day. And again, if there's any issues that could be going on that there's concerns about, certainly we want you to go visit the primary care physician and see if it's worth it to have a referral to the urologist.
Talking about water, how much water should one drink each day?
So when I was growing up, all the doctors that I saw said that we needed to have 8-ounce glasses of water a day. And in my opinion, I usually will base my recommendations on a couple of things, including how well are the patient's kidneys working, do they have other medical issues like congestive heart failure or kidney disease that may affect their ability to tolerate a lot of water. I would argue that for most people, roughly 40 to 60 ounces of water a day is a good goal to reach, especially if you make that what you drink the most every day. From a urologist standpoint, we see a lot of folks with kidney stones, especially now that we're in the summertime. And so a lot of these folks are oftentimes drinking a lot of soft drinks, coffee, tea, and that's in a lot more volume than the water they're drinking. And so that can certainly set them up for problems.
We have a few questions from Roger on Facebook. The first question is, how can I avoid kidney stones?
Great question, Roger. So going back to the fluid intake, that's a primary way to help reduce your risk of forming kidney stones. So water intake, especially if you have a history of kidney stones, I would definitely encourage you to get much closer to 60 ounces of water a day and really cut down on soft drinks, especially the dark ones, because they do increase your risk of kidney stones. There's a couple of foods that you could limit, including chocolate, nuts, spinach. You don't have to get rid of these things completely, but if you keep them to one serving a day or less, that usually is going to help it. You also should keep a low salt diet. That's good for a couple of reasons, including keeping your blood pressure a little bit on the lower side. But the more salt that you take in, it will dump more calcium into your urine and increase your risk of kidney stones. So we definitely encourage you, especially in these hot months coming up and that we're in now, to really stay hydrated, especially if you're outside. If, 50 to 60 ounces of water is what we want you doing in general. If you're outside sweating, you should probably consider doing even more than that.
Another question from Roger. Why does Eliquis blood thinner cause more bruising than Plavix blood thinner?
Well, as a urologist, I may have some limited information regarding the difference between Plavix and Eliquis. I've seen patients who take both of them. In my experience, both patients will have a tendency to bleed easier because those medications are meant to thin the blood out. I think it also depends on a couple of other factors that are patient dependent, including how well the liver's working and some of the other medications they may be on, which can also be considered blood thinners, and these include things like over-the-counter ibuprofen and other type of anti-inflammatories. So for that, I would probably refer you to your primary care physician or whoever's prescribing the medication just to help clarify the answer between those two medications.
We have a question from Maxine. Dr. Graham, how can I avoid urinating a lot at night?
Hi Maxine, thanks for sending your question in. Well, that answer is a little bit difficult to answer simply. So there's a lot of different factors that can go into why you wake up at night a whole bunch to urinate. But things I would just say off the top of my head, number one, I'd try to figure out what time you're going to bed. If you're going to bed around 10, 11 or later, oftentimes you're drinking fluids all the way up to that point, which is going to increase the amount of urine production that you make, which is going to increase how often you're going to have to wake up at night to go. So definitely cutting fluids off maybe an hour or two before bedtime. I'd also consider avoiding any sort of thing that's going to make you go more often in the evening, like caffeine, alcohol. Alcohol can be a diuretic, which means it can make more urine production. So you normally want to try to limit that in the evening. And then we also would consider, how often are you urinating during the day? If you're only going once or twice during the day, it could be that it's putting a little too much pressure on your bladder, forcing it to have to go more at night. So we definitely would encourage you to go more frequently during the day, maybe at least every 2 to 3 hours by the clock, not necessarily by how you feel. But certainly that could also be a reflection of other medical issues. So we'd always want you, if that's going on, to consider going to the primary care doc and getting an evaluation and maybe a referral to a urologist.
Another question from Danielle. Will you describe a typical day in clinic as a urologist?
That's a very good question, Danielle. I can't imagine who that'd be coming from. But the clinic is led by a bunch of wonderful, wonderful nurses who spend hours at a time working for their providers, countless hours on the phone, interacting with patients, interacting with insurance companies. So, of course, the clinic is usually pretty busy, but we have a very great support staff which help it to run as smoothly as possible. Good question, Danielle.
Another question from Mr. Roger. How can I reduce the size of my prostate?
Okay, Roger. So oftentimes if a doctor does an exam on you, he may comment that the prostate feels enlarged, or you'll have some other test indicating the prostate's enlarged, and that may be causing an effect on your urinary symptoms. So there are ways to reduce the size of the prostate in the form of medications. Sometimes if it's fit for that patient, we'll consider trying a medication to help reduce the size, oftentimes which will decrease the chances of urinary problems. There's also some ways we can do it surgically. Typically we're not going to run off and do that first line, but we do have options to do that should medications not be a good fit for that patient. In either case, an enlarged prostate can mean multiple things. So again, it's often best to seek out the care of the primary care doc or the urologist to get that evaluated and to get it treated.
What are the changes to prostate cancer screenings?
Okay, so this is a big one. This is a good question. So approximately 6-7 years ago, and all before that time, it was routine for urologists and primary care physicians to screen all men, no matter what their history was, around the age of 40 and almost every single year following that. There was some studies that came out around 2011 which suggested that there be some changes and maybe some more in-depth look at our screening process for prostate cancer screening. So the results of years at looking at that and testing and studies basically got to a point where we need to readjust how we screen for prostate cancer, because just using a blanket to screen all men the same is probably not the best way to go. So the current recommendations do include whether or not you have a family history of prostate cancer, whether or not your race puts you at an increased risk for prostate cancer, that being African American men are at a higher risk for prostate cancer than Caucasian and Asian men. And so what we've done now is try to narrow down who's going to benefit the most from prostate cancer screening. It's still done commonly with a PSA blood test as well as a digital rectal exam. I would argue that most men who do not have a family history and are not African American would benefit from getting a PSA sometime in their 40s and certainly starting at age 55 all the way through age 70. Once you get past age 70, there just needs to be a discussion about the risks and the benefits of continuing prostate cancer screening, because sometimes we find that to go hunting for prostate cancer at that point may not benefit that patient. It may actually be more harmful than good. But definitely this is an issue that has been adjusting over the years, and so we encourage we encourage our patients to have a conversation with their primary care doctor or their urologist to decide if PSA and prostate cancer testing is best for them.
We have a few questions coming in about UTIs. One, what is the primary cause of UTIs, and does cranberry juice help with UTIs?
Okay, good questions. These are probably some of the more common things that we see in the office. Regarding the cause of urinary tract infections, oftentimes there may not be just one reason for a urinary tract infection. Sometimes it's more simple things such as proper hygiene. For females, that may include after urination wiping from front to back. From a male or female standpoint, making sure that the bladder gets emptied often during the day. The longer the urine sits in the bladder, the higher risk there is of a urinary tract infection. It may be that the bladder's not completely emptying, which can increase your risk of a urinary tract infection. There can also be other things that go on, such as urinary tract abnormalities, blockages, stones. So it really depends on a good evaluation to help figure out what are the primary causes for that patient, and then we try to reduce those risk factors. As far as cranberry supplementation goes, I do believe there is a benefit. There have been studies done with results showing both support and a lack of support. But certainly the risk of using cranberry supplementation to help prevent urinary tract infections is generally thought to be low. So using whether it's liquid supplementation or capsules, generally that's something that's probably going to not do any harm, and it may do some help.
We have another question that came through through the website. I have varicose veins in my genital region. What can be done?
Okay.
Can anything be done?
Sure. So in this area, there can be enlarged veins both in a male within the scrotum itself or on the outside on the skin. Depending on the location will determine what we often would recommend for treatment. But oftentimes The issue just needs to be evaluated by a urologist, and we can then determine if it's something that would require maybe some prescription cream. Maybe it would necessitate a procedure. But either way, I feel like we'd probably be able to find a good answer to decrease the chance of that happening again.
Melanie asks, how important is it to have newborn boys circumcised at birth?
Good question, Melanie. So some of these recommendations will come from the American Academy of Pediatrics. However, from a urologist standpoint, whether or not the newborn boy gets circumcised or not, oftentimes is a parental choice based on whether it be their religious beliefs, cultural beliefs. In general, it is not absolutely mandatory that a circumcision be done. There are plenty of males plenty of males that are uncircumcised that go about their daily lives without any issues at all. But there are some risks that can go on if that skin is usually a little bit on the tighter side, especially as the infant grows to toddlerhood and then beyond. There can be a increased risk of infections. There can be an increased risk of pain. There can be some difficulty with cleaning that goes on. So oftentimes having a discussion with the pediatrician about the pros and cons, or about a urologist may be able to help you get an idea if it's something that you want to pursue.
So if a boy is circumcised later in life, say around 12 or as an adult, is it harmful in any way?
So we see a fair number of patients that need evaluation for possible circumcision later on in life. In fact, the oldest gentleman I've ever done a circumcision on was about 89 years old. So it's definitely possible to have done at any point over the course of a man's life. In general, once they get beyond a few weeks of age, the more common way to have the circumcision done is in the operating room under anesthesia. So if they were 10, 12 years old, we'd probably consider doing a procedure in the operating room, doing the circumcision in the operating room under general anesthesia. Often the risks of that are pretty low. The anesthesiologist, the doctor that puts the child to sleep, will go over with the parents what those risks are. But nowadays the risks of the anesthesia are pretty low. But from a male standpoint, from having the circumcision done at some point later on, usually everything's going to heal up fine, and that male will be functional in every sense of the word after the circumcision, even at that age.
Is the treatment for male and female incontinence the same?
Not necessarily. There are some differences in the urinary tract between male and females. In a female, the urethra, or the tube that the urine exits from the bladder and before it hits the body, is much shorter in females than it is in males. And so that's oftentimes why there's at least a partial reason why women will have a higher risk of urinary tract infections than men. And men have a prostate and women do not. And the prostate sometimes can come into play when you talk about urinary tract infections. So there are some common reasons, things that we mentioned earlier, as far as infrequent urinating, holding the bladder too long, and incomplete emptying that will happen across both sexes. But there definitely are some anatomical differences that I think will play a role in the causes.
This is our last question from Facebook from Lee. Is there a specific test in women in their 50s that women in their 50s need to take to prevent urinary disease?
So Lee's asking about a test in a woman in her 50s to screen for urinary disease. In general, there's nothing that's standard of care to screen women for urinary tract problems. With men, we have prostate cancer screening, which most urologists would recommend for. In a woman, generally going to the primary care physician and getting your routine labs done. That'll often include blood work, which can evaluate how well the kidneys are working. In a woman in her 50s, that should probably get done at least once a year. Oftentimes, they will also have a urinalysis, which is a giving a sample of urine in the office, which can be run and screened for various things, including kidney problems, potential liver problems, blood in the urine, and urinary tract infections. So that should probably be done once a year, at least with the blood work to evaluate the kidney function, and then talk to your primary care physician to see if a basic urine test needs to be done to evaluate those other systems.
Another question from the website: what are the symptoms and treatments for low testosterone?
Okay, that's a good question. So low testosterone is one of these conditions where we oftentimes can't find a specific problem on exam. It's usually a constellation of symptoms that the male patient will have. These commonly include things like increased fatigue, decreased energy, just not being able to do what you could do before. Sometimes that can be based on an effect on your sleep, though, so we'd evaluate that. And there's some other conditions that can cause that. Decreased libido or decreased sex drive. Sometimes there can be an issue with erectile dysfunction that can be associated with low testosterone. There's also issues that can go on with mood disorders and sleep disorders, which can be affected by low testosterone. So if you have those symptoms and it doesn't seem like anything else could be related to that, affecting that regarding other medical problems, then you may be a candidate for evaluating for low testosterone and then potentially even for treatment.
And our last question today: what screenings are recommended for men, and what age should these be performed?
So that's a good question, and we touched on that a little bit with the prostate cancer screening, and that should probably be the major one for men. Most urologists would probably recommend that a blood test called the PSA, prostate-specific antigen, get drawn maybe sometime between 40 and 50 to at least get a baseline level of where that number's at, as well as a rectal exam. Now, the PSA, the blood test, has come under fire in recent years, especially back 5 or 6 years ago, when there was a suggestion that it may not be a helpful test to screen men for prostate cancer. I believe that most urologists would argue that the test has a very important role in prostate cancer screening, and that without it, we are left with much less sensitive tests, including a rectal exam, which could find and detect prostate cancer, but sometimes that could occur too late. So current recommendations are to talk to the primary care physician or your urologist, see about getting a baseline PSA level between 40 and 50, and that's argued, and that's probably a consensus among most urologists. But from the American Urological Association, getting a PSA between the ages of 55 and 70 for low-risk men is our current recommendations. Of course, that's going to change if you have a family history, or if you're African American, or have some other risk factor that will put you at a higher risk for prostate cancer. So ultimately, you need to get the evaluation done so we can see where you fall under that classification. Everybody sent in some great questions. I really appreciate you guys paying attention and taking part in this Facebook Live session to learn a little bit more about men's health, being that it's June and Men's Health Month. Again, I'm Dr. Stephen Graham from the North Shore Urological Associates here at North Oaks and Hammond, and I appreciate your time, and have a good day.